The Ebola outbreak in West Africa is now an international public health emergency. The World Health Organization made that declaration today, calling for an extraordinary response to stop the deadly disease from spreading. Meanwhile, members of Congress are hearing about the disease's devastation from leaders of Samaritan's Purse and SIM. They're the Christian organizations whose missionaries have contracted Ebola.
There is no way to count all the people dying of Ebola in the villages and in the remote areas.
If we do not fight and contain this disease in West Africa, we will be fighting this disease and containing it in multiple other countries around the world. And the truth is, the cat is most likely already out of the bag.
The confirmed death toll in West Africa now stands at about 1,000 people.
And for more on the Ebola outbreak and what it means for Americans concerned about the disease spreading, Heather Sells spoke with infectious disease specialist Bogdan Nugay-Bauer. He's a doctor with Centera Medical Group in Virginia Beach.
How easy is it to catch Ebola, or if there are to be more patients here with Ebola, how easy is it to catch it?
It is not so easy, although in Africa, for example, it's much easier than here. But one reason that is not so easy here is because we do not have a pool to generate this virus, which in Africa would be the fruit bats. Also, we do not have the same cultural habits as some of those African countries have to consume, for example, bushmeat, which is raw meat of chimpanzees or gorillas. It's much easier, for example, to contract flu rather than Ebola virus.
So when we see these workers in these hazmat type suits, are they really going above and beyond to just be extremely careful?
We always want to be sure that we are doing everything possible to prevent transmission. The scientific community knows that the only way to transmit it is through body fluids. But scientists are always concerned that maybe it could be transmitted through aerosols. So this is why our scientists try to use all possible ways of isolation to prevent this transmission.
Okay. At this point in time, we're reading in the news that Ebola is in more countries, and I know there really is growing fear here about it. How concerned should Americans be at this point in time about what is going on?
All the countries where it was reported were African countries. There is a possibility that someone with Ebola virus may travel outside Africa, and that just happened when 2 of our citizens were brought here. But all possible precautions were taken at that time, and I don't think there should be any scare among our public at this point.
The 2 missionaries were brought here, and they are battling Ebola. Do you think the CDC did the right thing in bringing them here?
Absolutely, and it's not only morally correct, but it's also the right medical decision, because we have to offer to these 2 American citizens the best treatment that exists, and we have the best possible supportive care that exists.
A lot to think about. All right, Dr. Nugay-Bauer, thanks for your time.
Thank you.